She's a physician and heads up the women's product line. And she's going to have a lot of information for you about someone who might be considering pregnancy, if you're in pregnancy, or just fertility questions in general. I think Dr. Lane will be a wonderful resource for you in regard to that. We also have Dr. Cezanna, and she is from Riley Hospital. She's a hospitalist and a pediatrician, vice president of safety, quality, and performance improvement at IU Health. So two extraordinary doctors here with us tonight to share their perspectives. And as always, our stalwart leader in the community of Fishers around all things COVID, Monica Heltz, our director of our health department, who is going to be answering questions as well. She's been on the front lines of this battle from day one and has heard many of the questions and many of the concerns that we hear from our residents, and frankly answers them on a daily basis, while also administering a tremendous amount of vaccines and tests and trying to keep up with all the news that's out there. So first and foremost, I want us to get grounded in just the foundation of what the vaccine is and what it isn't. And I think what has challenged so many people is that this vaccine has been developed in a different way with a different technology than what perhaps some of us have been used to with the myriad of vaccines we've had over our life. So Monica, when we talk about mRNA, or we talk about Moderna or Pfizer, and specifically the development of those vaccines, what is the technology and how is it different than perhaps vaccines we've seen in the past?
So it's different, and it's really able to target things very specifically, but it's not that different, right? So most vaccines are made by taking like dead virus or a piece of a virus that you don't want to get infected with, and they put it in some other viral vector that isn't going to make you sick. And the purpose of all of that is for your body to recognize the proteins on the outside of the virus and to be able to fight those proteins and develop antibodies so that when you see the real thing, you've already got your defenses ready to go. So the mRNA vaccines aren't that different, except for that they use, instead of taking pieces of actual virus, they take just a little snippet of like a copy of the code of the virus, the part that tells your body how to make the protein. So the only thing that you're looking at is the protein part, which is the part that your body needs to make those antibodies. So it's different, but it's not that different, but it allows us to target our defenses very specifically. And it also allows for the kind of ability to change the vaccine quickly if we need to, based on these variants. So that's what's so exciting about this new mRNA vaccine. But it's, like I said, they were still targeting those same proteins on the outside of a virus. We're just doing it in slightly different ways. And this way, we don't actually put any virus inside of us. The other thing about mRNA is that it's programmed to self-destruct. So it never goes in the nucleus of your cells. It just goes into the cytoplasm, where it tells your body, okay, make these proteins, now go recognize them and go fight them off. And then it self-destructs. It erases all copies of those instructions. And you're just left with the antibodies to fight the virus should you ever see it.
So Dr. Cezanna, I know you've spent a lot of time in the last month having conversations around this. And one of the things that I think people hear when they hear RNA, they immediately jump to DNA. And even if people don't necessarily understand what DNA is and what it does for your body, they are very protective of their DNA and don't want it to be affected by this technology. So can you talk about the interplay between mRNA technology and what it does or doesn't do in regards to kind of your blueprint of who you are from a DNA perspective?
Yeah, certainly. So that's exactly right. It is different than DNA. It helps the body make proteins like Monica described. You have mRNA, you make mRNA too. It's because you're essentially one giant protein when it all comes down to it. You're some water and fat too, but you are made up of proteins. That's what makes you you. That mRNA is sort of like, as Monica said, it's messenger mRNA. So it overlays the DNA, makes a copy, goes out, makes a protein, and then it goes away. It never, ever, ever gets incorporated into your DNA. So it can't change your DNA because it never actually attaches to it, but it doesn't get incorporated into it. And as soon as it makes the copy, it comes off, makes a protein, and it's gone. The other thing that's really important about this is, yes, you've never heard about this, and thank goodness you've never heard about mRNA technology. But mRNA technology actually in vaccine development has been around for decades. And the reason why in the US we've never heard about it is because we've never had vaccines that we needed in the US. But to be clear, there are actually vaccines today that exist that used mRNA technology, and one is Ebola. And thankfully, none of us ever needed a vaccine against Ebola, because that would have been devastating had Ebola made it to the US, like COVID made it to the US. So I think that's an important thing to remember, is that it's been around for a long time. It's just that we haven't had to use it in large scale. The other cool thing about about what Monica said is the reason why these vaccines are able to be developed quickly is because it's not hard to make these vaccines. It's much harder to make the vaccines, the other vaccines that you receive, because you have to grow them in culture, in cells and all that kind of stuff to make them, to manufacture them. And you don't have to do that with mRNA technology. And so I often tell people that, hey, that's a part of why this is so phenomenal that we have these vaccines today, we wouldn't have had them as quickly if we hadn't.
So one of the things I've heard in passing, and you've used the term a few times here in your conversation, and I used it as well, is this word technology. That leads them to believe that whatever you're inserting into someone or injecting into someone has some sort of technological component to it. So when people say mRNA technology or the new mRNA technology, can you explain the technology side of that? Because I mean, I've heard things as, regarding its connection to 5G cell towers,
Right.
So this technology component of the definition, can we talk about that for a second?
So that's a really good question. I've never been asked that, but now thanks for saying that. So when we say technology as physicians and healthcare professionals and vaccine manufacturers, what we're saying is that's the process we used to make the vaccine. So we didn't insert, to be clear, there is no metal inserted in you. There is not a chip inserted in you. There is nothing like that inserted in you. There is this tiny piece of mRNA. There's some salts, there's some sugar, and there's some fat. And that's what the vaccine is made of. That's it. You can go read I actually read the ingredients off today to somebody. And that's what it's made of. It has to have a little bit of fat in it so that it gets into your arm. It's just the way we deliver it. It's why it looks a little bit cloudy in the vial. And then the salt and the fat the salt and the sugar you have to have just to make it a liquid, frankly.
So it's basically like my Thanksgiving dinner with a bit of RNA.
Yeah. Just throw a little RNA in the turkey.
Right,
there you go.
So now that we kind of have a better understanding of what it is, Dr. Lane, I want to bring you into this conversation. You talk to women and couples all the time that are considering having a child or currently pregnant. And I know, and I've talked to so many people who are very, very concerned that this somehow has an adverse implication on a person's fertility, on both a male or a female. I have people that work for me, young males, that are very concerned about getting the vaccine because they think it's going to affect their fertility. So can you talk a little bit about the conversation around fertility first and foremost in its relationship to receiving a vaccine for COVID?
Yeah, thank you. I want to say first that of all the vaccines that we have available, there are no studies that suggest that any vaccines, including the COVID vaccine, cause infertility in men or women. In fact, we encourage women or couples to come in to have preconception counseling so that we can ask them specifically if they've had chickenpox, if we can find out if they're still immune to rubella so that we can vaccinate them in advance of pregnancy. And so in advance of them getting pregnant. And so, I consider vaccines, little miracle drugs in the sense that there are numerous diseases that we do not see as a result of vaccinations. I mean, I got chickenpox as a kid. My kids and, you know, our kids here on this call, and many of the residents of Fishers, their kids will never experience chickenpox. I mean, that's probably one of the few times I missed school because I had chickenpox. And, you know, we have a vaccine now that will prevent our kids from having the chickenpox, which, you know, truly is. And while a lot of kids don't get really sick, some kids do, and it's very dangerous in pregnancy. So I would tell all couples that are considering pregnancy, the best thing that you can do, in addition to meeting with your physician to kind of do that preconception counseling, is to be vaccinated for COVID. So that's one less thing that you have to worry about when the time comes and you are pregnant.
So then when you are pregnant, you know, in your first trimester, or even at any point in your pregnancy, should I be concerned about going out and getting the vaccine, even if, you know, some of us have had side effects in terms of not feeling well after getting the vaccine for a short period of time? Does any of that impact the pregnancy, or has there been any studies that show that even if someone, you know, for that next 48 hours feels really, you know, pretty worn down, or, you know, not feeling great, does that have any impact that you have seen so far on a pregnancy?
Yeah, there's no evidence to suggest that getting the COVID vaccine, even if you have a reaction, and whether you're pregnant or not, some people react differently to the COVID vaccine. And so if you are pregnant and you get the COVID vaccine, and you get a low grade temp, or you have chills, we recommend that you take Tylenol. That's a normal reaction. It is self-limited. It will not impact the fetus at all. And we recommend the COVID vaccine at every stage of pregnancy. So there isn't a time of your pregnancy where we would say it's unsafe for you to get the COVID vaccine. And I think a lot of that has to do with what Michelle and Monica talked about in terms of the technology and the safety of it. You know, we are not providing you a vaccine that's got foreign material in it. So it's exceedingly safe at every stage of pregnancy, as well as after pregnancy with women that are breastfeeding.
Well, that's a great question. Always a sensitive subject. So, you know, what you can ingest when you're breastfeeding. So that's not a concern either.
No, not at all. And in fact, if you're vaccinated when you're pregnant, it's much like, you know, we recommend now that women get vaccinated for whooping cough, because we know that that immunity is going to be conferred to the fetus. It's going to go through the placenta, and it's going to provide your baby with some immunity against whooping cough. While, you know, we don't know exactly how long the immunity would last for a newborn, we do know that some of those antibodies, those protective antibodies, do cross the placenta in a protective way, so that there's some protection for the newborn, which is, you know, outstanding. Again, another benefit. And then if you are breastfeeding, getting the vaccine again is safe for you to have administered while you're breastfeeding.
So Dr. Lane, like I said earlier, I have a lot of male-dominated industries under my purview, police and fire departments, you know, a lot of young males, and their number one reservation to getting the vaccine that I've heard from the folks that I talk to is this belief that it will affect their fertility. Can you talk about any studies or anything that's been out there in terms of its effect on males' fertility if they were to get the vaccine?
You know, again, I think all vaccines that are available, none have shown any infertility, including COVID, in men or women. So that has, you know, the data has supported that, again, for all vaccines, not just COVID. So there's nothing to suggest that male fertility is impacted by the COVID vaccine in any way.
So one more question for you, Dr. Lane. You know, medical professionals, I think, started getting vaccinated as early as December or January of last year. So have you delivered any babies so far where the mother has been vaccinated?
Yes. In fact, I delivered a baby in September, and she received her care initially in California, transferred to Indiana, and I delivered her baby, and she got the COVID vaccine. She did great, you know, no side effects. And we are, because the Indiana State Department of Health, as well as the CDC, issued an advisory back in September, strongly urging women that are pregnant to get vaccinated, because we were seeing in August a record number of deaths. And while when you think about all of the pregnant women, it's a small number, but again, I think that we have to think about the other effects of COVID infection, not just deaths. And they are wide ranging, and we're learning more and more about what COVID infection and pregnancy, some of the side effects are. And just the risk of death is not the only concern.
Sure. Dr. Cesano, I want to jump into the conversation around children. As a pediatrician, we've got a lot of questions from folks. First and foremost, why is the dose different for children than adults?
So the easy answer is it's because that's the way the studies were done. And so what Pfizer did initially was in the very first, vaccines go through 3 phases, as well as every other drug that goes through the FDA process, go through 3 phases. The first phase, they actually looked at 3 different doses of the vaccine. And so when they tested it, they found that, and this is a phenomenon that happens with children all the time with vaccines, is children have amazing response to vaccines. Older adults, the elderly, actually do not. They are on the end of it's hard to get them immune to something with a vaccine, but they're the highest risk. So we have to vaccinate them. So we have higher doses in adults, typically in vaccines, because we need that to be able to get you to have an immune response versus a child. So when they looked at those 3 doses, they wanted the lowest dose that produced the best immunity with the lowest amount of side effects. And so that was the dose. They chose a dose, it's 10 micrograms, which doesn't really mean anything to anyone. It is a smaller dose in ages 5 to 12, or 5 to 11, sorry. They get the smaller dose. And then 12 and up gets the same dose the adults get. And frankly, it's just about what they tested, and that the side effect profile was better in that with that dose. They still get 2 shots.
Does that play into the extended period of time between the 2 shots then for kids too? One of the questions we got from a resident was, why is there a 5 to 7 week period of time? And maybe we need to confirm whether this is actually true or not between the first and second shot for children.
It's still 21 days.
21 days. Okay. So
Yeah,
that may be a point of confusion, because I think one of our questions that was written in earlier was asking, why is there a 5 to 7 weeks instead of, okay.
No, it should be. Yeah, it should be. It's the same separation to the first 2 of Pfizer, because that's the only one that is approved in children. So 2 doses separated by 21 days.
Okay. Because that was a question. They said their pediatricians are recommending that they wait 5 to 6 weeks rather than 3 weeks.
I don't know why that would be, but no, you can get it, and we recommend it and get it as soon as you can. Get it, yeah. Okay, because then you're fully vaccinated. You're considered to be fully vaccinated 2 weeks after you received your second dose.
And then this another question, very similar. What is the difference between a 4-year-old and a 5-year-old and 12-year-old and 11-year-old? Now, I have 3 boys, 7, 3, and 1, and I find there's a huge difference between a 4 and 5-year-old on a lot of fronts, but anatomically or biologically, what is the difference and why did they pick those ages?
So they have to pick an age. And so they pick that age. I would tell you typically 5 to 11 is elementary school. 12 to 17 is that junior high, high school, and you're going through puberty. And at least, there are kids that will go through puberty younger than 12, but that's why we usually use adolescents. And then the little guys, the less than 5 is just, it's a different category. And your body changes a tremendous amount from, you think about birth to 4, how much you grow and everything, and you're going through a lot of different changes. And so they have to pick cutoffs, frankly, too.
I think that's part of the heightened sensitivity as the body's changing so much in either those formative years of 1 to 5 or in those years where kids are going through puberty, a lot of parents have expressed a lot of concern over fertility again, that somehow bringing this vaccine into that person's life, into their biology at those critical times of growth and development, it's going to somehow affect fertility. And I know I'm kind of talking about this over and over again, but this is probably the most prevalent conversation. So can you just, Dr. Lane or Dr. Cesana, talk about, again, this fertility component, if the vaccine's administered to someone even prior to being able to conceive from an age perspective?
Well, I think Dr. Cesana definitely should start just as a pediatrician. I mean, how soon are you vaccinating babies? And these are not concerns that parents bring up, in the very, early months of their newborn's life. And so I like to bring that up a lot of times to, parents or concerned individuals, because we don't question those vaccines and we don't ask about fertility. So as a pediatrician, I'd be interested in your perspective, because you understand the immunization schedule much better than I do.
I agree. I agree completely with you, Indy, that there is no reason from an immunologic standpoint or anything that this would have an impact on fertility. And you're right. We vaccinate young children, babies, with a number of different vaccines. You mentioned one of them, whooping cough. And I think what's really important is to remember that it's not approved in children under 5 yet. So we want to vaccinate as many people as we can to protect these guys. Because the other thing about this is, let's not forget, there in the early part of this pandemic, this didn't affect children, but we have seen a 10-fold increase in the number of kids hospitalized, and also in the ICU, and also with what's called MIS-C, which is multi-inflammatory systemic disease, which those things they're not benign. They're not, that they don't recover from these things, and the serious disease. And so I think that's a really important part of this, is to weigh what we're concerned about being possibly risks, but they're not, when we've seen the history of vaccines that we've given over the years compared to what we do know COVID causes.
What do we know about, there's stories out there about young men, I should say boys, having a particularly adverse side effect.
Uh-huh.
Can you talk a little bit about that?
Yeah, sure. I sure will. So the side effect. So first of all, let me just say the side effects in children are rare and minor, just like they are in adults. Kids get the same stuff. They get the sore arm, they get the fatigue, they feel achy. I have 3 kids. They've all gotten the vaccine. One of them had that. The other 2 are fine. They didn't. She had some achiness and stuff, but the other 2, nothing. What you're talking about is that there are reports of boys, of adolescent males, and then young adult males, like in their early 20s, who have had something called myocarditis or pericarditis. Myocarditis is inflammation of the heart. Pericarditis is inflammation of the sac around the heart. The heart sits in a little sac. It looks like, I told somebody it looks like turkey skin, which it does. And so that can get inflamed. What we've noticed is these are small numbers, about 54 per million doses, million persons who have received the dose is what we saw reports of that happening in. It is self-limited. And what I mean by that is it will go away. It happens generally in the first 10 to 14 days after receiving the vaccine, maybe as late as a month. And so that's important to realize. And so we have studies in children, the studies done in 5 to 11-year-olds, there were no cases of myocarditis reported. Then in our older kids, like I said, maybe 54 cases out of 1 million people vaccinated. However, you can get myocarditis and pericarditis from COVID, and it's much worse. It's much longer, and it is not self-limited. And you can also get it from a number of other other viral illnesses. That's actually how people get myocarditis and pericarditis, is usually viral. So it can be from influenza, it can be from other things, commonly other common viruses too. But that's the important thing, is that it was self-limited in all the reports that we saw associated with the vaccine compared to what we've seen. It's a much higher incidence if you get COVID.
So I've had this ongoing debate with my wife. We've both had our shots, both our original vaccine and our booster shot. And both times that I got the shot, I felt pretty bad the next day for 24 hours. My wife felt fine. I'd like to chalk it up to the fact that I have an extraordinary immune system. And so I've tried to share with her that it just demonstrates my physical prowess when it comes to this. But is there any merit to my argument, or is this pretty random in why one person would feel fine the next day and another person doesn't? Should people be reading into that on some level?
No. No is the answer. I'm sorry. No, but we had the same experience at my house in reverse. I had this, for my second shot in the booster, I felt miserable for a day or so. And my husband was like, I'm fine. He's like, I got a shot. No big deal. So sorry.
Well, my wife's not listening tonight, so hopefully she.
Okay, there you go.
One of the questions we had kind of as we look forward, one of the questions we got from a resident is when do we think, and this is for any of you, maybe Monica, you have some insight on this, when do we think teens are going to be eligible for the booster shot?
Well, I've probably seen the same news reports you have, which is that Pfizer has submitted some data for 16 and 17-year-olds to get booster vaccines. So some reports have said that it could be pretty soon, this week, next week, but I don't have anything solid yet. As soon as they're authorized by Dr. Walensky from the CDC, we'll be able to start administering them.
Okay, and we just got a great question, because I take these things for granted, and they're really great questions. What's up with the booster thing? It's not something that people are familiar with. In our other vaccines, you got them when you were little and you never talked about it again. Now we're seeing, I got a shot, months ago, and now I'm back in getting another shot, and now there's conversations about additional boosters.
But
what is
but they are. We do boosters for lots of vaccines. The tetanus shot, you need it every 10 years. The whooping cough every time you're pregnant or you have someone in your life that's pregnant, to protect the babies from getting that. This isn't the only thing.
So do you think it's unusual, and I shouldn't use the word unusual, but is it unique or different in this case, the rate at which we're seeing boosters come out? So, we rolled out the vaccine, and then very shortly we're doing a booster. Is this more akin to a flu shot kind of scenario where it's an annual thing? I mean, explain why we're in a cycle where it's pretty shortened in terms of the amount of time that this thing lasts before you have to get a booster, and what does the booster do in terms of protecting the individual?
Do you want to take that, Dr. Saitana? I'm gonna just say we are in a pandemic, so right. That's the big impetus for needing to get these boosters and to make sure that we have the maximum amount of protection for the whole population.
Yeah, I was going to say that too. I think the reason why you see everything with the speed with which it's happened is due to the pandemic, and while the pandemic is not a good thing, I often tell people it will be a really interesting time to look back in medicine in about 10 years and see how, or maybe sooner, but to see how we were able to develop these vaccines with the speed and the rapidity that we did. And I think it's a testament to a lot of things. It's a testament to industry, to research, to the government helping. We would not have been able to do this had we not had so much collaboration, but then also importantly and sadly, that we had so much disease. Because the only way you can develop a vaccine so quickly and to be able to know whether it prevents disease is to expose people to the disease. You don't have to go very far before you're exposed to the disease. And so that's why the booster has come out so quickly too, is because of that we still unfortunately have a lot of disease.
And can you clear up I do think when the boosters first originally came out, they weren't as clear on who should get a booster and who shouldn't. And can you talk a little bit about, first of all, what is the recommendation for a booster? I think Monica, pretty much hit us right between the eyes. Everyone should go get a booster. But the way that it was rolled out was very confusing for a lot of people as to whether they quote unquote qualify. And what was that qualification really? From my perspective, it was more of a throttling back so that we get the people who are most vulnerable the booster first because they had limited resources. It wasn't that certain people it wasn't good for them to get it. It was just get in line where you should. But can you talk a little bit about that? Because I think people are very confused around, should I get a booster? When should I get a booster? All that kind of stuff.
So at this point, I can say everyone 18 and up is recommended to get a booster if it's been at least 6 months since they had their 2 doses of either Pfizer or Moderna, or anyone who's had the Johnson & Johnson if it's been at least 2 months. So everyone, boosters for all. You get a booster. You get a booster. Everybody gets a booster. There were a lot of criteria when they rolled it out, and they updated them frequently. So it was hard to stay on top of all of that. So it's not a surprise that people were fairly confused because the CDC updated their risk profile list all the time. And in the end, there were so many things on it that it pretty much was everybody.
Dr. Cesano, you mentioned earlier, and unfortunately, we are seeing a significant number of young people contracting COVID right now. More so than we saw in the early days. And one of the questions that's coming up often is my son, my daughter actually had COVID, and now we're on the backside of that illness and they're symptom free and they're back at school. When is the appropriate time for that individual, that child, to go get a COVID shot versus natural immunity?
Yeah, so the best time for them to get it is obviously they have to be recovered and out of quarantine so that they can be out in the community.
Sure.
And we'd say usually if they did not have COVID and MIS-C or receive monoclonal antibody, because some kids will receive monoclonal antibody. If you got monoclonal antibody, you have to wait 90 days. But for a kid who had COVID, didn't have any problems, they can get it, 2 weeks if they're out of their quarantine, or, to a month would be fine. Those kids, as well as adults who have had COVID, they are a little bit more likely to have the soreness and the achiness and all of that stuff. And I think we know that, a lot of us know that or have heard that anecdotally. So I wouldn't tell your kid, hey, this is going to be fine, you're going to feel great. Because I think it's really not nice to set kids up unfair, like set your
That's
expectations. True. Yeah. So, but they can go get it.
But there's no adverse interaction between the natural immunities that you built up and the mRNA that we're now introducing into the body.
No, not at all. And in fact, it's just it gives the body another reason to develop more antibody. And every time the body gets exposed, and it develops more antibody to it. And that's also the theory behind boosters, or behind a next shot, is to give your body you get another injection of it, it sees it again. It goes, oh yeah, I need to make antibodies again. So yeah, no worries.
I think a question came in, and I'm gonna repeat it kind of verbatim so that you kind of understand the tone and tenor of the question. But is it safe to say that for the booster, it is a best guess of the medical field because there is no way there's been enough time to have significant data regarding the booster shot?
Well, I think you have to remember, so that's interesting. It's an interesting way to think about it, but remember that I think you said earlier, so I received my first shot December 20 something before, right before Christmas. I remember that. I received my second shot January 14th. I only remember because it's my mom's birthday. And so it's been close to a year for some of us. And if you think about the number of healthcare professionals, because we were the first as well as the elderly, that's a significant number of people that have received a vaccine to know what our immunity has been doing, and also then seeing cases of COVID as well. So, and breakthrough cases too. So I don't think that it's it is like, it's our best guess. I think there's some really good data behind why we needed it too.
And so let's talk about that why for a second. So you and a lot of folks in the medical profession in our senior populations got it, a year ago. I would assume that between today and then, there was a significant amount of research being done on how well the body continued to develop or provide those immunities, and whether that started to wane over a period of time.
Mm-hmm.
So
Right.
the why behind this, I assume, is an observation of a waning immune system around this specific disease.
Correct. And the other population of people that I forgot to mention are the people that the vaccine was tested on, because there were about 30,000 people that this vaccine was tested on. And all of that was done like in the summer of now I'm going to get my dates all mixed up, right? The summer of 2020, because then that data had to be submitted to the FDA and that took a little bit of time to get the EUA. So we actually now have people, it's almost 18 months worth that they could study and see. To your point, you're exactly right, to see if the immunity was waning.
So Monica, one of the things that has come up that I've talked to several people about is this whole conversation around the flu. So if you remember when we were working on battling COVID last year, there was a lot of conversation about, well, the flu has gone away. And so there was some theories that COVID was just being used as a term to discuss the flu. But let's get past that. Yeah, but let's get past that and talk about flu shots and COVID shots. And should they get both? What happens if you get both? Are we recommending both? I think that's an important conversation, because I know the flu is, as people are now back in society and they're interacting, people are, going to Thanksgiving dinner, all those types of things. The flu is now still a reality. So can you talk a little bit about what, from a public health perspective, our recommendation is around the flu shot and COVID?
Yeah, you should absolutely get the flu shot sooner than later, yesterday if possible. And you can get it at the same time you get your COVID shot. They can be administered together. Last year, we think about all the different behaviors that we did that were different than in previous years. And one of the key behaviors that we all did was mask wearing. And so that really cut down on flu activity. It's actually, there's some theories that it may have cut down on asthma exacerbations as well, because there was a drop in asthma exacerbations among kids. I'm sure Dr. Cesana knows about that. So some of our behaviors, I think we're learning by, some of these things that we've implemented for the pandemic, that they actually have other benefits to health concerns. So I think we'll definitely see more mask wearing among people that are concerned about those things going forward. But flu, we expect, and we're hearing that we need to expect a worse season than we've seen for a while, certainly worse than last year. Last year was very mild. So we definitely recommend flu shots. Again, they can be administered with the COVID vaccine or in any amount of time aside from the COVID vaccine. I think now that so many people have experienced what side effects from a vaccine look like with the COVID vaccine being taken up so broadly, hopefully that will help make flu shots a little bit more palatable to people, because one of the things that people always said with the flu shot is that, they thought it gave them the flu, when in reality it was their immune system kicking in to say, hey, I am making antibodies and I'm working, so hopefully all of that we've seen with the COVID vaccine will translate into more uptake of the flu vaccine. We know that the flu vaccine is very important in preventing deaths among children and elderly from the flu and the rest of us. So it's again a community protection technique. We all need to think about our whole community when we're doing these kinds of things, and that's what vaccines really are. It's a way for our whole community to protect those of us who are vulnerable.
I think we have some.
Sorry, I want
Go
to
ahead, Dr. Lane.
Pregnant women are considered a high-risk group. So whether it relates to COVID or the flu. And so, if you are pregnant or contemplating pregnancy, definitely get the flu vaccine. Any infection, whether it's with the flu or with COVID, it causes a risk of preterm delivery. And again, we talk a lot about the risk of death, but with COVID, we have seen a lot of preterm delivery and delivery of pre-viable babies. And there's nothing more devastating than a healthy woman who is excited and looking forward to having her baby, who gets an illness now that is preventable, who develops either preeclampsia that we're starting to see an association with COVID, or develops preterm labor and delivers her baby either early or pre-viable. So I encourage every woman, again, that's another reason to get vaccinated for both the flu and for COVID. Sorry to interrupt.
No, that's an excellent point. I'm glad you brought that forward. Dr. Saisana, one of the things that we hear often in the debate, particularly at the flashpoint of the school system, and this is not just Fishers, this is nationally, this idea of the mental health of children in regard to COVID. And the question is more from the resident, is more geared towards mass and social isolation and things like that. But I guess I want to flip it on its head here a little bit and talk about why vaccines might actually be the key to avoid a lot of the things that we've had to do that maybe did lead to kids having some challenges. So can you talk about holistically, as you take care of kids from a medical perspective, what is the path forward to some degree of normalcy for our kids in our school systems going forward?
I would tell you the path forward is vaccination. And the reason why I say that, because it is true. There were an unprecedented number of children and adolescents who suffered from mental health issues throughout the pandemic, and adults that, and a lot of that was due to the spread of the disease and the things that we had to do, like Monica talks about, the public health measures that we had to take. The vaccine protects you from getting COVID. It also, let me back up. It protects you from getting severe COVID, enough to get you in the hospital or in the ICU. But the other key thing it does is it reduces your ability, even if you get it, to spread it. And that's really important, because especially in children and adults too, but in children when we're talking about school, because kids need to be in school, and school is good for children. It's good for socialization. I, as a parent, am very grateful that I had 3 older teenage kids who do well in school. I can't imagine what it was like to have a kid who's learning to read, because I'm not a good teacher. I'm a good doctor, but I'm not a good teacher. And I am so grateful for all the wonderful teachers out there that Indy and I our kids have been in school together and are friends. And so I know how hard it had to be for people. And vaccination is the path forward, because it then means kids aren't out of school and kids aren't quarantined. And we have to still quarantine because of the risk of this and the spread and the way it spreads. So I would say that's the single best path forward. I know it sounds really redundant, but it is, and it also helps us get back to being able to do all the things that we want to do, and the things that are really good for kids, like sports and other social activities.
So I have a couple more questions for you guys, and I want to respect everyone's time this evening. You 3 are probably the busiest women in Fishers right now, but breakthrough cases. Some people throw up their hands in the air and say, see, what's the point of getting the vaccine? I just heard of a friend of mine who got the vaccine, felt like crap for 24 hours, and lo and behold, 3 weeks later is exposed and gets COVID. Can you talk about how effective these vaccines are or are not? And then is it still of benefit for someone to get the vaccine, and even though they may have a breakthrough case?
You want me to take part of that, Monica? Or do you want to take?
Sure.
I can take the beginning part. So they are very effective. What I think got a little confusing in the beginning is that when we threw out numbers like 80 and 90% effective, what people translated that to be was that I will not get COVID. What that was effective at was you will not get hospitalized, end up in the intensive care unit, and die of COVID. And so, yes, you can still get a breakthrough case. This vaccine is not the same as some of the other vaccines that we have, like MMR, where you get the vaccine, you're not going to get measles. That's called sterilizing immunity. This is not that same, doesn't offer the same level. Now, we thought it was very promising, but it's still very promising, because the point is, the reason why COVID is so bad is because over 700,000 people have died from it, compared to about 30,000 people a year from flu, and the strain on our hospitals, right? So it is still well worth getting the vaccine, because it will potentially prevent you from ending up in the hospital, especially in those folks who are older, who have other comorbidity, like other, conditions like heart disease. And I know people have had breakthrough cases too, but were at risk for really bad COVID had they not been vaccinated. And so I think that's the point to remember, that it's what it's doing to prevent us from hospitalizations.
Right. And we see it with flu, right?
We do.
You can get the flu shot and you can still get the flu, which is often an argument that patients will, give me for not getting the flu shot, because they got the flu shot and they still got the flu. But, as Michelle mentioned, we are trying to prevent hospitalizations and deaths. And the people that are in the hospitals now and the people that are dying are largely unvaccinated people. This is a disease of the unvaccinated.
Mm-hmm.
So let's talk about that for a second, Monica, just the current conditions that we find ourselves in, in Fishers. I was reading last night that Indiana ranks, I think either 45th or 46th out of 50th in the percentage of people who are vaccinated in their state. Can you share a little bit about where we stand as a community on kind of the front lines of getting our people vaccinated, but then also, as a percentage, I don't know that you know these off the top of your head, but the people that are still getting infected in Fishers, what percentage of those are people that are unvaccinated? As Dr. Lane said, this is a disease of the unvaccinated. Is that the reality that we see in our own community?
Yeah. So as far as where we're at, we're relative to the state of Indiana, we're doing very, very well. We are approaching 90% of our adult population having received the first shot. I think we're at 88%, and we're approaching 85% having received both doses of the vaccine. Our 12 to 17-year-olds are in the 60 percentile range, 12 to 17-year-olds who have been fully vaccinated. And we're not yet sure where our 5 to 11 years old age group is, although we've administered over 3,500 shots at our vaccination site as of today, and over 70,000 shots total at our vaccination site. So certainly we're doing all the things that we need to do, but we still have thousands of people in our community that are unvaccinated, and we're still in a metro area where there are larger numbers of people unvaccinated and where people are consistently traveling around. We're a very mobile community, arguably one of the most mobile communities in the state. So we don't have this ability to completely buffer ourselves. So we have to do everything possible to have higher rates than anyone else vaccination, because that's our best protection. And we have to recognize that we're a very mobile community, and there's no way that we can create systemic immunity for this whole area that we're constantly traveling within. We have a lot of commuters into Indy and some of the other surrounding communities. So that makes it very difficult for us to, like I said, create a bubble around ourselves. We are seeing a very large divergence in case rates between vaccinated and unvaccinated. So even though there are breakthrough cases among vaccinated individuals, we know that they're not as severe. We know that they're less likely to spread it to others. We know that they're less likely to spread it for as long of a period of time, even though the isolation period is the same and it's standardized. Right now, as of our report yesterday, our vaccinated case rate for fully vaccinated individuals having COVID, our case rate is around 20 per 100,000 of our population, versus our unvaccinated population has a case rate of 91. So there's a pretty big divergence, and we've seen that pretty consistently. It mirrors the national trends of having about a 6 times higher rate of COVID in unvaccinated individuals. And then when you talk about hospitalizations and death, that rate goes to a 13 times greater risk. So it's pretty significantly different. It doesn't mean that you're Superman or impervious to all things if you're vaccinated, but it certainly lowers your risk profile significantly, as well as those around you, your loved ones, your family, and your community that you care about.
So I know, Monica, you and your team and Dr. Lane have worked very, very hard to provide the resources to make it as easy and as accessible as possible if someone decides for themselves or for their family that they want to be vaccinated. Can you just talk about what resources are available today for a Fishers resident, or really, frankly, for anyone in Central Indiana right now that would want to get a vaccine? From our perspective, are the resources there, and what do they have to do to get them?
Vaccines are absolutely available in lots of different locations. And the easiest way to find a place to get your vaccine is to go to ourshot.in.gov. But a lot of the pediatricians and primary care providers are now starting to have the vaccines available. So if you prefer to have a chat with your provider, that's an option as well. Our pharmacies all offer the vaccine, as well as, for folks here in Fishers, our Fishers COVID vaccination site at 116th and Brook School. We can accommodate lots of people at that site. So if you're having trouble getting an appointment anywhere else, you can always walk in at our site. You can walk in for your booster. You can pick any of the 3 options. You can walk in for your pediatric vaccines. We have plenty available. Our appointments right now are booked out about 2 weeks, but you can absolutely walk in.
I think that's an important point, because I think every time they've rolled out a new group of people that can get vaccinated, there's always a question as to whether there's an available resource. And so if you have a child that you would like to get vaccinated today, they can walk into our vaccination site and receive a vaccine that day.
That's right. And we do also have additional supports, although, you may want to, again, see your private provider, your pediatrician, if you have a special needs child or someone that requires additional supports. We do have a number of our nurses are trained in working with like autistic children and other kids with special needs. So there are supports in our facility as well, where someone can mention to the registration staff that, they want a private area or, low stimulation area, and a nurse that's, used to working with autistic kids or one of those kinds of things. And we can offer that. But, some parents and families, they have better success when they go to their pediatrician. So that may be an option as well.
So I'm gonna leave with one final question for each of you to answer. And I can't stand Facebook, even though I know we're live streaming tonight. So I find that ironic. But there are a lot of people out there that are getting their information from a variety of sources. And I actually appreciate the fact that people are interested enough to seek out information. If you were talking to a loved one, a friend, a patient, and there are people that just for themselves need to go find this information, regardless of what someone tells them, they're just wired to be the type of people that need to go research and learn this for themselves. Where would you point them? Each one of you, I'd like to hear from you. Where would be a resource that they could go and find an objective opinion, and not even really an opinion so much as just information? So Monica, I'll start with you. Where would be your go-to to point someone?
So, I, as a public health person, I'm always going to say the Centers for Disease Control because it's an important source of information. But more generally speaking, for information about any kind of, when you're looking for expertise in a field, I would say go to the body of people that have the experts in the field. So the American Academy of Pediatrics, if you're looking for information about children's medical care, the Association on air quality, if that's what you're looking for, but those organizations spend a lot of time and resources compiling all of the studies, and they make their recommendations on the compilation of a large amount of studies, not handpicking studies that support an opinion. And that's what we find with a lot of the Facebook information. It's either anecdotal or it's handpicked studies. You're always going to find studies that are divergent, and there's a lot of reasons why. There's a lot of difference in quality of studies and the variables that they use. That's why you look at these compilation of studies to make those recommendations. And so that's the types of places I would go.
Dr. Lane, how about you?
I totally agree with Monica. As an OBGYN, and we talked a lot about fertility and pregnancy and breastfeeding. So I would advocate the American College of OBGYN, or ACOG. They have resources for patients in layman's terms. They answer a lot of the questions that women that are attempting pregnancy or who are pregnant or breastfeeding would have. And to Monica's point, there's no hidden agenda. These are professionals that look at all the data. They make recommendations based on objective information, not based on opinion. I think, knowing Dr. Cesana well, we are, committed to the work that we do, and the people that work in these organizations want what's best for people. This is why we do what we do. And so these are the trusted sources of information that we rely on to counsel patients, to talk to the residents, and they rely on the CDC and other reliable bodies of information to make these determinations. There is no incentive for the government to want to hurt people. I think the government wants nothing more than for everybody in these professional medical societies, for everybody to get back to normal, get our economy going, get our cities, and towns back to normal, so that we can put this behind us.
Great. Dr. Cesana, how about you?
I would agree. And so I go to the American Academy of Pediatrics. I'm a fellow of the American Academy of Pediatrics, similar to Indy and what she said about ACOG. I think those are very reliable sources, and the CDC too. I think the CDC does a really nice job putting it in a way that anybody can read it. And I agree, none of these organizations have an agenda and a reason to slant something. They just want what's best for everyone, because they're in the business of public health and trying to make it better and get the economy open and get kids in school and get us, back to doing the things that we want to do. I also think that it's important when you go to those sources, how they lay out the information for you to understand in layman's terms is really important, because some of the research is complex and it's difficult to interpret. And so they do it in a way to make it so that patients can understand it, people can understand it. And I have a lot of, they're committed to that, especially I would say the American Academy of Family Medicine too is another really good resource as well. All of them have done a lot of work to put in patient-friendly language about any topic, not just this, about all kinds of things.
And then I guess I would, in closing, I'm certain of this, but I just want to reiterate, for those that just want to ask someone or talk to somebody, I'm certain in this kind of politically charged environment, they don't want to be judged for the questions that they have or the concerns that they have. And so, I'm sure you all three have had countless conversations with patients, friends, residents. How comfortable should they feel as coming to each one of you to answer those questions and deal with those issues?
I think they should feel very comfortable coming to us. I think there is a sort of sacred trust with your physician, and that you walk into their office. We know as physicians, you are vulnerable. You're in a vulnerable state. You're scared. And we are taught to help you and to help you make the best decision possible for you. I always feel like it's my job to lay out information for you. You're going to walk out of my office and do what you want to do. But let me lay that out in a way that hopefully allays your fears and gives you the best information possible so that you can go and make that choice. That's called shared decision making. And so our goal is not to judge people. Our goal is to take care of you and arm you with the information that you need.
Excellent. Well, on that, go ahead, Dr. Lane.
And I was going to say, I think people are far less defensive. And, Monica, I'm sure you've experienced this too, when you are providing them with information and they feel as though they have a choice. I talk to patients every day about a lot of different issues, many of which are not life-threatening. So you've got a spectrum of choices, and ultimately you have to make the choice that's best for you. My job is to provide you with the information and answer questions and counsel you. Your job is to make the decision. While I feel very strongly about vaccines, I still feel that way about a person's decision to take the COVID vaccine or have the COVID vaccine administered. My job is to provide hopefully reliable information and to direct them to sources. And certainly we'll be interested in Monica's perspective too. But I think that that's what our role is. It's not to I don't go about trying to convince you. My job is to allow you to make an informed decision. That's what I think we all want to try to do.
Yeah, I mean, I think these concerns are real, and they're real to a lot of people. And it's, we're here to help walk through that. That's one of the reasons we wanted to have this town hall. Any Fishers resident certainly can call our hotline and get through to one of our nurses or myself or epidemiologists if they have specific questions. We'll direct them to the best person to answer those concerns. But your provider, if you have one, is another good resource. And it's important that you feel comfortable with the decisions that you're making and you know why you're making them. So absolutely, everyone should be their best advocate. And we all feel strongly about the safety of these vaccines. But it's a lot to try to work through and understand. And it's there are questions that, people want to have the opportunity to ask. And hopefully we've been able to answer some of them today.
Well, I want to thank all three of you for your time. I know how busy each and every one of you are, and I want to thank you also for your diligent work in your profession. I know the last 2 years have not been easy, and I know Fishers, and I'm sure your patients are grateful for your diligence and your professionalism. And I appreciate your time tonight. And for our Fishers residents, thank you for taking part in this. Our sincere hope is whatever decision you make, it's based on real and actual information on behalf of you and your loved ones. So with that, thank you all and have a wonderful evening.
Hey, good night. Thank you.
Good night. Thank you, everyone.